everyone, Susie here, back with another stretching video for the quarantine self-care. Today we're going to work on the shoulders, the forearms, and the hands. I know that I've worked on the forearms and the hands, showing some stretches, as well as some in the shoulders, so a lot of these are probably going to be repeats, but this video will be dedicated solely to those stretches, so you won't have to go searching for them in the other videos. So we'll start with the shoulder, and then we'll move down the arm and into the hand. So we'll get started with the pecs first. Okay, so first we're going to start with pec major. Now this stretch is usually done standing up, but for camera purposes I'm going to do this sitting down, which does work just as well, but you know, if it's more comfortable doing sitting, if you don't have anything behind you, then that's okay, but preferably if you're standing, you know, that would be the way to go. Okay, so what you're gonna do is first you're going to put your hands out in front of you, straight out in front of you. You're gonna take a deep breath, and on the exhale you're going to bring your arms back slowly. And while you're doing that, you want to make sure, I'm going to turn around, that you're engaging your rhomboids and the muscles in your upper back, right? So take a deep breath. I'll do it both ways. Exhale. Making sure to squeeze those muscles. Right, and you're stretching your pec major, and then you bring your arms back in front of you. Okay, from there you're going to raise your arms 20 degrees, still in front of you. Take a deep breath. On the exhale, same movement, but 20 degrees higher. Hold the stretch for 2 seconds. 1 Mississippi, 2 Mississippi, and come back. Take another deep breath, up 20 degrees. This is the last one. Exhale. Squeeze, squeeze, squeeze. Now on this one, when it's up there, you want to take your thumbs and supinate them. So you're turning them outwards. Right? You're turning your palms up. So you're supinating. And while squeezing back, supinate your hands, and then hold that for 2 seconds. And then come back forward. And then you want to repeat that sequence 2 to 3 times. First, right in front of you. Hold for 2 seconds. 20 degrees higher. On the exhale, squeeze, hold for 2 seconds. Come back to center. Up 20 degrees. Exhale, stretch, squeezing those muscles, those rhomboid muscles and the upper traps. Okay, and at the same time, supinating, turning your thumbs out. Okay, and that is all pec major. Okay, so next we're going to do pec minor, which has a couple of different ways to stretch or to get the stretch for pec minor. So pec minor actually sits underneath pec major. Pec major is the most superficial muscle, and it fans out like this, and then pec major sits underneath and kind of fans out from here and branches up into this way. Most people actually tend to get more pain from pec minor than pec major. And pec minor is actually one muscle that is really responsible for a lot of upper back pain and stuff, because these muscles are weak and they are tight, and so you need to really stretch out these muscles to give some relief to your upper back, and you know, therefore you won't feel as much strain on your upper back because you're allowing these muscles to stretch out, and therefore allowing the muscles in your upper back to relax. So therefore, for pec minor, you're going to put your hands, this is the first way to do it. Put your hands behind your head, and you want to put your hands pretty like low on your neck so that your elbows are sort of like up. Not just this way, but more up. And make sure your head is neutral. So you're going to take a deep breath. And on the exhale, same idea as pec major. You're going to bring your arms back. Try to squeeze those muscles and hold it for 2 seconds. And then come back. So you're not going to move any degrees like you did with pec major, partially because you're not covering as much ground. But you do want to repeat this stretch about like 8 to 10 times, no more than 15. If you're really feeling a good release from that stretch, go for it. If on every exhale you feel like you can bring the stretch a little bit farther, you may do so. Just be careful, because you don't want to go past your limit and then you'll be feeling it tomorrow and wishing that you didn't push it too far. So most important thing with any of this is listen to your body. All right, so do this one more time. I'll demonstrate. Hands low on the neck. Deep breath. Exhale. One Mississippi, 2 Mississippi. Come back. And trying to, there you go. See, I'm looking at myself in the mirror or in the camera and saying something is not right, but I couldn't figure out why my hands weren't more this way than this way. Okay, so that is the first pec minor stretch. The next one is usually done in the doorway. I am going to do it on the edge of a chair, again, just for camera purposes and not having a door or a surface high enough to tape myself. All right, so you want to if you can see, this is the edge of the chair. So that would be your doorway, your door frame. And you want your arm to be a little bit higher. So you don't want it necessarily this way, right, at a 90-degree angle, because that's not targeting pec minor. So you want it more in a diagonal and more above, and you're simply gonna put your hands on the door frame where it's that comfortable height, and you're simply going to lean into it. Take a deep breath. On the exhale, right. After 2 seconds, come back and repeat that like 5 times. And again, you should feel the stretch right in here. You may also feel a little bit in your upper back because, again, while you're stretching those muscles, you're allowing the muscles in your upper back to take a break from overcompensating to make up for the tight muscles going on in your chest and pecs, usually caused by computer work and text neck and everything that we do these days. Seriously, everything. All right. So those are the 2 ways to do the pec stretch, the pec minor stretch, I should say. Okay, so the next muscle that we're going to do is the subscapularis, also known as the subscap. The subscap is one of the 4 muscles in the rotator cuff. It is located underneath the shoulder blade, so it is kind of a tough muscle to get to. It is also an uncomfortable muscle to get to, sort of like the psoas, because it tends to be very tight, and sometimes it will give off the sensation of being ticklish because of the fact that it's so tight. So it's one of the more invasive muscles to work and tougher to get to for some of those reasons. So this stretch would be good to just kind of get a little bit of relief in there. For this, we're going to incorporate a little bit more PNF, which we will see in quite a few of the hand stretches. And so the PNF is going to help to really get a good stretch and help to break up the fascia that might be restricting those muscles from getting a proper stretch. So for this one, again, you want to do it in the doorway. For camera purposes, I'm going to do it on the chair. This one, I don't recommend doing the lazy way against the chair or sitting down. This one needs to be done in the doorway to be done properly. So what you want to do is you want to make sure that your elbow is against your body and your arms in a 90-degree angle. And so what you want to do is put your hand on the edge of the door, and for the PNF part, we're going to try to medially rotate your hand in towards your body. So you're on the edge of the door and you're trying to push in. So you're really just kind of, in a sense, pushing forward because of how your hand placement is. But regardless, you're trying to pull your arm and your hand towards your midline, towards the middle of your body. So you'll do that for 5 to 10 seconds. And you're resisting, right? You're resisting against the doorway. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Do the exhale. And on the exhale, you want to walk in the door with your arms still, with your hand and your palm still against it. You don't want to lean. You want to walk. So actually taking steps. And then you'll feel that stretch right in the back, right up here. And then hold that for 2 seconds, right? And then you want to repeat probably 3 to 5 times, where you try to immediately rotate in towards the midline. Hold that for 5 to 10 seconds. And then you're going to relax and take a deep breath. On the exhale, you will walk in the door, take a couple steps until you feel that stretch, making sure, of course, to keep your arm at 90 degrees against your body and keeping your head neutral. I know I'm not explaining this one exactly the best, so if you have any questions, just let me know, but it is pretty self-explanatory. So, again, as long as you should feel that stretch in your subscap, sort of, but in the back, but it's coming from like under your shoulder blade. Okay, that would be subscap. Now, another way to do this, I'll show, is with the strap. Now, this is easier to do because you don't have to stand in the doorway, and you're basically doing the same PNF technique. You're just using your strap or your rope. Okay, so for a subscap with the rope, you're going to loop it around your hand like this, and then you want to bring it around your back. Again, keeping this elbow at a 90-degree angle. And keeping it as close to your body as possible. And then holding the rest of the rope with your other hand and trying to keep it as close to your hip as possible, just to give a little assistance. Okay, so you're going to do the same thing, the medial rotation, resisting against. So you want to hold your rope super tight in the opposite hand, the hand that you aren't stretching. And so hold that super tight, and then for 10 seconds, again, you're going to want to try to immediately rotate, but you're resisting, right? So as this is pulling, this isn't really allowing your arm to move freely like that. All right, so 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And then you're going to inhale, and on the exhale, you're going to want to laterally rotate, so away from your midline, and you're going to assist with that stretch by actually pulling the rope as you're laterally rotating your shoulder. Right? So, excuse me. So hold your arm out, and then on the exhale, if you can see, I'm pulling with this arm, but instead of pulling it tight to keep from moving to the midline, I'm pulling and assisting with that stretch. So instead of walking into the doorway, you're using the rope to, in a sense, take those steps for you and slowly bring that subscap. And it might have to be a little bit lower. You know, mess with it until you feel that stretch right up in here. And yeah, so that's subscap. You want to repeat that a couple of times, of course, 2 to 3 times as usual. And that should be good for that one. Okay, so next we're going to do the bicipital tendon. This is the tendon for the long head of the bicep. This is another muscle that actually gets overlooked for being very important in what's responsible and the main root as to why people's upper backs hurt. Because again, we're hunched over, so these muscles are shortened, the pecs are shortened, and then the biceps get shortened because it's all connected. And you've heard me say that a million times if you are a client of mine. So to do this one, I'm actually going to do it on the chair. I decided the only way to show this one properly was to do it standing up. So I adjusted my camera a little bit. All right, so. And remember, for all of these, if you have one particular side that bothers you, of course you can stretch more on that side, but please try to do both sides and stretch your body evenly. Your body craves balance. So if you are just stretching one side and not paying attention to the other one, then you're gonna get really out of whack. You might get more aches and pains because then one side is totally relaxed and the other one is going to overcompensate for that. So again, balance is key. Okay, so for this one, you're going to put your hands, if you're, I know you can't see it really, but my hand is in the front of the chair, right? See, magic trick. So, you're going to want to do, we're doing some PNF again. So you want to stand, you don't necessarily want to take too many steps. You can take a step to feel a slight stretch, and then you're going to push your hand against the chair. So no matter what chair you are using, as long as it has a back, you want to make sure that you're pressing against it, sort of like you're trying to knock it over. But without that much force. All right, so do that for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Inhale. And then on the exhale, you're going to take a couple of small steps forward until you feel the stretch within your bicep. Kind of going down your arm. It might feel a little bit like it's hitting deltoid, but it's actually underneath that and a little more to the side. So again, you're going to take one step forward, and then you're going to push against the chair for 10. Relax. Inhale. On the exhale, take small steps till you feel the stretch in your bicep. Hold it for 2 seconds, then relax and repeat it 2 to 3 times. And that is your bicep tendon for the long head. The bicep has 2 heads, the long head and the short head, hence why it has the name bicep, which means bi means 2 from Latin, and etc., etc., etc. That's a whole other anatomy lesson we don't need to get into. All right, so this next one I'm gonna do for supraspinatus, which is another muscle of your rotator cuff, which sits at the top of your shoulder. It tends to get really tight and bothersome underneath the acromion process. To do this stretch, I'm actually gonna show it facing away from you so that you can see the movements that I'm doing. But again, this will additionally be a PNF stretch technique. So let's get into it. Okay, so you're gonna want to take the shoulder that you're trying to stretch, and you're going to adduct it behind your back. So you're adducting and adding it to your midline. So however comfortable it is, just place it behind your back. Then you're going to take the other hand and you're going to grab the wrist of the arm that you're adducting. So, against resistance, you're going to try to abduct your arm away. So basically you're trying to bring it back to neutral. And again, against resistance, because this arm is going to be holding you from allowing to pull your arm fully back to your side. Okay, so for 10 seconds, again, you're going to try to abduct your arm, abduct. So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. Take a deep breath. On the exhale, with this arm in assisting in pulling, you're going to stretch into by then pulling into the adduct. So 1, 2, and relax. Then from here, you'll do the same thing. So you're not moving back into the position that you were. You're moving the stretch farther from the position that you are resting in from the last repetition. So, take a deep breath. And then resist. So for 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax and then adduct by inhaling, and on the exhale, bring the stretch farther, holding for 2, and then relaxing, and then repeating it 1 additional time. Then repeat on the other arm where you are holding with this wrist, and take a deep breath and pull, or you're gonna pull away first for 10, breath, and towards the midline even farther. All right, that is your supraspinatus, though it also gets your levator scapula as well as your upper trapezius, and it helps to prevent upper cross syndrome, which is pretty much like responsible for getting all these muscles tangled up, and the nerves included as well, which could lead to thoracic outlet syndrome. So that is a really good one to do. Next, we're going to do the anterior scalenes and the sternocleidomastoid. This one was shown in the neck and back routine, but again, it's where you turn your head to the side, looking up a little bit, taking your hand behind your head. I need to get, all right, we'll do it this way because that works. So you're going to turn to the side. So if you want to stretch your left sternocleidomastoid, you are turning your head to the left, because in order to stretch, you have to turn it to the same side. Okay? So SCM, turn to the left, stretching the left, look to the left, then look slightly up, and then bring your hand over your eye and pull back a little bit. This arm doesn't need to be up there, it can be relaxed at your side. Right, on the exhale, is when you're gonna stretch and hold it for 2 seconds like everything else. And that is your SEM and your anterior scalenes. Then we are going to move right into, I think that's it for the shoulders actually. So from there, let's move into the arms. Again, the arms and the hands, these are almost all have been shown, I think, in previous videos. But again, it's a good recap. And I'm also going to introduce a little bit of PNF. I do not remember if I did that with the self-massage video. All right, so we're gonna start out with the forearm forearms by doing a little bit of the wave. This is just going to help to kind of relax the muscles in your forearm and warm them up for the stretching that we're going to do. It also helps kind of, release the wrists a little bit, and just kind of makes everything a little bit more mobile. So do that a few times. Might even relax you a little bit. And then from there, we're gonna do some wrist rotation. So you want to hold your hand with your opposite hand, or hold your wrist with your opposite hand. So the one that you're rotating, and this helps to stabilize those wrist muscles and tendons and just everything that kind of gets stuck in there, carpal tunnel, just the nerves, the ulnar and the radial nerve. Just want to release a little bit of that pressure. See, if you're like me from working with your hands so much, as well as breaking wrists from playing soccer, I was a goalkeeper for 10 years. I mean, I played other positions too, but goalkeeper was my number one. So, from breaking my wrists from playing soccer, I now have a lot of what's known as crepitus, and basically that's just when your joints don't have enough synovial fluid to lubricate your joints. So it kind of makes those popping and cracking noises. It's usually nothing to be of concern. There are some times where cracks can be a little bit scary or a little bit more intense, but especially in the wrist, especially if it's involuntary from doing this, then it's absolutely fine. All right, so we got some wrist rotation going on. And that's also just to help warm everything up. Another really good stretch for your wrists, especially for your flexors, is to turn your palms up, and if this movement is comfortable for you, to just stretch them out that way. And then for your extensors, you turn your palms this way and stretch them into your wrists. I know for myself, I've been practicing handstands a lot, and so my wrists tend to hurt. Obviously I haven't been massaging, but between doing that for 13 years and then being a goalie for 10 years prior, my wrists really aren't as strong as one may think. So exercises and stretches like this are just really great if you're active and you do a lot with your hands. So even if you just work at the computer, your wrists do get super tight after a while, and it's just a really great stretch. So you can do that along the floor, or you can do it just with your arm out. Now, another way to do it, again with PNF, is you are doing a little bit of traction. So you're trying to, in a sense, pull your hand away from the rest of your arm. So you're tractioning and then stretching. So we're not doing PNF for this one. But it's a traction and then a stretch. And you should be able to get a little bit farther each time, and using the same principles as you exhale into the stretch. Hold it for 2 seconds and release. And then, if you want to go even farther, which wrists only have so much of mobility in the joints, obviously you can't pull your hand all the way back, but if you feel like you could do another round of stretching it even farther, you could continue to hold your hand like this, like a chicken wing, and take a deep breath and stretch a little bit more, and then release. And then if you want to do the same thing 2 to 3 times, then go for it. So that is to get your wrist flexors, and your wrist extensors. For your wrist flexors, you would do the same thing, except you're turning your palm up and then tractioning again and pulling down. So you might think you're getting the same muscles, but you're not, right? And so that's for your flexors. Pulling away, tractioning, stretching, exhale, and holding for 2, and releasing, and traction, and stretch. 1, 2. And that's a really good stretch. You'll feel that all up into your arm. Let's see. Then we'll do ulnar and radial deviation. This will have a little bit of PNF. So for radial deviation, what you're going to want to do is, so you're holding your hand out like this, and then you're grabbing your fingers with your other hand kind of as a clamp. And then what you're going to want to do is you're going to want to try to push your hand up against resistance of this hand. So 5, 4, 3, 2, 1, relax. You can do it for 5 or 10 seconds. And then you are going to, once you relax, you're going to bring the stretch farther. And you want to try to keep your wrist as straight as possible. Because that's where you're going to get the stretch. You want to get it like in here and then in here. Okay, so again, for radial deviation, you are going to want to resist by pushing your hand up against your other, with resistance against your other hand for 5 to 10 seconds. Relax, and then you're going to do ulnar deviation, which is bringing your pinky towards your wrist for the stretch. 1, 2. And if you need to assist in the stretch with this hand, do it that way. Okay, and then from there you want to do ulnar deviation. So you're doing the opposite. So you're going to take your hand, the same hand, and with the resistance, you're now going to be doing resistance going up. So, or I'm sorry, going down. So you're resisting bringing your pinky towards your wrist or down towards the floor. So 5, 4, 3, 2, 1. Relax. Just for time purposes, I'm only going to do 5 seconds. And then from there, you're going to inhale, and on the exhale, you're going to stretch or ulnar deviate up. Okay? So you'll do your ulnar deviation with doing the PNF towards the floor, holding 5, 4, 3, 2, 1. Relax, inhale, do. Then the stretch with radial deviation, bringing your thumb towards your wrist, and hold for 2. 1, 2, and relax, and repeat 2 to 3 times. So when you're doing radial deviation, you are doing the PNF portion for radial deviation. So when you're doing radial deviation, that means you're doing PNF going up, so resisting going up, and then stretching into ulnar deviation. When you're doing ulnar deviation, you are PNFing down, so your PNF is within ulnar deviation, and you're resisting going down, and then after that you are stretching into radial deviation, which is bringing your wrist up. Okay, so I hope everybody understands what that means. Okay, so next we're going to do the supinator. So the supinator is the muscle that is responsible for turning your palm up. So what you're going to want to do for this technique, it is PNF as well. So you're going to want to put your arm out, but try to keep your elbow at your side. And then you're going to want to grab your wrist with the opposite hand. And from there, let's see. From there, you're going to want to resist supinating, right? So you're resisting turning your palm up for 5 to 10 seconds. So 5, 4, 3, 2, 1, relax. And then you're going to inhale and you're going to turn your palm down into the stretch. Now, you could also add a little bit of traction to kind of separate in that supinator a little bit. So, traction and then lean into the stretch a little bit. All right, so you're going to do that again 2 to 3 times. So you are holding the wrist, you are resisting turning your hand up, your palm up for 5 to 10 seconds. Then you relax, inhale, and on the exhale, you are turning your palm down. And for a little bit added, you can traction, which tries to separate and lengthen that tissue, and then go into the stretch. And that's your supinator. Okay, so for the last 2 stretches that we're going to do for this segment is going to be for the fingers and for the thumbs. These are pretty important muscles to stretch out. Again, especially if you do work at a computer or you are known for being on your phone a lot. If you get cramps in your thumbs, this next one is going to be really great for you. So we're getting into the palmaris and thenar muscles. So you're going to want to grab your thumb with your other hand, and you're not really grabbing it too tight, but you're sort of fitting, kind of taking like a clasp and just fitting it right over your hand, like so. And it's just like a nice little pocket for your thumb. You want to make sure that your other fingers are fanning out towards your palm so that you're getting the entire muscle. And then you're going to want to traction a little bit, pull that thumb just a smidge away, and then lean back. Like, don't you completely lean back. Just lean back into the thumb with those fingers. And do that a couple of times. Again, exhaling into the stretch, holding it for 2 seconds. Sometimes the thumb feels really great that you want to hold it for a few extra seconds. So go for it. I do it. Just remember, if you hold the stretch for too long, longer than 30 seconds, then you're risking injuring yourself because, then the muscle doesn't know what to do and you might be stretching it past its limit and irritating the tendons. So that is for the thumb. And then for the fingers, you can do each individual one on its own. And that's just stretching it back. You could do a little bit of traction where you pull out the finger a little bit and then bend. So pulling it away, like pulling somebody's finger, without the consequences. And then stretching down. And you could also do all of them at the same time, making sure that your, like the top of your palm is resting right on the fingers. And this is very similar to the flex stretch that we were doing. But it's targeting the fingers more. And one way to make sure that you're doing that is separate your fingers. And then go down, and then even just on the tips. You can actually get some really nice stretches in your fingers. Okay, so that covers it for the shoulder, the arms, and the hands. Next week we have the lower leg, or I should say the lower limb, from the thigh down to the foot. So we will cover that next week. And I really don't have any updated news on when exactly I'll be open. I don't have any video plans after the leg. I am thinking about maybe doing a question and answer episode. If that is the case, I might put something out for my next newsletter, so that you guys can, send in some questions that you have about my journey as a massage therapist, or something related to the industry, or certain conditions that you didn't know and you might have a question about, whether it pertains to yourself personally or somebody you know. So, with that being said, I hope everybody had a good Memorial Day weekend, though it was probably a little different than most. And I will see you again at the same time and same place. And have a good one. See you later. Bye.